mandate and Medicare funding are now officially all delayed until after the 2014 elections. Meantime, the President says things are going exactly to plan. Scary, because he might be right. This law might be designed to fail.
What's true, Ed, is that in a normal political environment, it would have been easier for me to simply call up the Speaker and say, you know what, this is a tweak that doesn't go to the essence of the law. It has to do with, for example, are we able to simplify the attestation of employers as to whether they're already providing health insurance or not. It looks like there may be some better ways to do this. Let's make a technical change to the law. That would be the normal thing that I would prefer to do. But we're not in a normal atmosphere around here when it comes to, quote-unquote, Obamacare.
Obama knows his health care law is very flawed. So, was Obamacare crafted so it must fail? And if so, is the ultimate goal a single-payer plan? That is, total control by the government of all aspects of your health care. Joining me now, private medicine advocate and Obamacare expert Patricia Newman. I believe, as many do, Patricia, that it is the ultimate goal of Obamacare to fail, to blow up, so Congress and the President and whoever else can say, well, we tried. Now we're going to have to go to the single payer. That is total control by the government.
I think so, too. I think that, you know, this is only going to lower the pain for employers and for those that pay insurance premiums for 1 year. But eventually, when this thing goes into full effect, I mean, just the idea of putting a cap on the out-of-pocket expenses is going to make premiums skyrocket. And eventually, employers will not be able to afford the premiums. And then everybody's going to have to be pushed into a one-payer system.
Right. It's like coming into work here and saying, hey, there's a cap of what you can pay Graham Ledger for doing the Daily Ledger show.
Right.
It is total socialism. There's nothing mystic about this thing. It is socialism, pure and simple. So this is rather a rhetorical question, but why would they delay this? Is it simply political?
I think it is. I think this is a big favor to employers, the large employers, the same employers that are getting a year break on the mandates are going to be able to take a break on the premiums going up. But you got to understand, these employers, you know, the increases in the penalties, which if they were to leave them in place, would have cost an average of $2.40 per hour per employee. In 2014, those are going to continue to go up. So Sebelius now in October of 2014 is going to decide, based on the percentage increase of premiums, how much more the employer is going to pay per hour per employee. And that is likely to be, you know, $250, who knows, yeah, $260 extra an hour. I mean, it's going to fail.
It's just more red tape for everyone involved here. So who benefits from this and who gets hurt by it right now, at least in the short term and then maybe in the long term?
In the long term, you know, in the short term, of course, the employers, the insurance companies also benefit because they look nicer, you know, their premiums are going to be cheaper. But eventually, everybody will lose, including these employers. As we stated, you know, their employees are likely to lose their jobs or go part-time so they can afford, you know, to pay them, but not offer insurance to them. You know, the biggest losers, though, are the young people. And these are the same young people, you know, the occupiers, the 99%ers that are very happy with wealth redistribution of the rich are going to find themselves shocked that the progressive dream is going to hit them too. And this is going to be health redistribution. The health that they have, these young people, is going to be used to pay for the illnesses of old people.
Right, and Obamacare collapses without those young people who may not normally buy health insurance, buying into the system, or paying that big penalty through the IRS. The thing that gets me Patty, is that during that news conference, when Obama was talking about just a little tweak here by not enacting this, now this is number 4 or 5 elements, big elements of Obamacare that's not being implemented, it is unconstitutional for a president to not enact a law. Exactly. And none of the reporters said, hey, Mr. President, you're being extra constitutional here.
And, you know, even if, I think the only one that I've really have heard pushing this is Dr. Rand Paul, the senator, who's also an MD. And he's the one that's bringing that whole premise to light, which is he doesn't have the authority to be changing the law without bringing it back to Congress.
Right.
I mean, he's following his own rules, and nobody's stopping him.
So is there a solution? Is there some sort of way we can fight back economically here? Do you have something for us?
I think there is. Even though there's only a very small percentage of HSA that are plans that are federally qualified, the minimum deductible would be, to qualify for an HSA under Obamacare, is $6,000 per individual, which is kind of stiff. But the good thing about it is it brings the whole idea of putting your skin in the game when it comes to being a good consumer of health care. The whole purpose of the HSA is to save money, which is tax protected, so it's pre-tax dollars, and you plan your consumer purchases, if you will. You're not going to show up to the doctor every time you have a little sniffle. You're going to wait till it's really worth it. So the insurance company expenses and the medical health care expenses, all of them go down when an individual uses an HSA. And just recently, the RAND Corporation did a study, 2012, that shows just the first year, people that changed from a basic plan to an HSA plan spent 21% less than the year before. And that is, I mean, that is huge. Now, if just half of the employers that now offer PPOs or HMOs would change to an HSA, the healthcare savings would amount to $57 billion in 1 year.
HSA is, of course, the health savings account, which who knows, one way maybe they'll figure out a way to cut those off under Obamacare. Who knows?
Hoping not.
Patty, thank you for all that. Coming up next, sequestration. Maybe it's not so bad after all, as the Daily Ledger